If you've ever watched a parent or a spouse start to slip, the repeated questions, the confusion, just the moment or moments that you realize something just is not quite right, you already know this conversation is more than just money. But the money part, it can destroy a retirement plan that took decades to build. And most people have no idea it's coming really until it's too late. I'm Sev Meneshian. I'm a certified financial planner practitioner and the founder of Public Retirement Planners. And on this channel, I help families build retirement plans that can actually survive the things that life throws at them. That includes things that nobody really wants to talk about. Now, by the end of this video, you're going to know exactly what memory care costs, who pays for it, and what specific moves you can make right now to protect your retirement from one of the most expensive events in modern financial planning. If that's the kind of content you want more of, go ahead and subscribe, and I'll put more of this type of content out there for you. Anyway, memory care is, without question, one of the most expensive line items in all of retirement plans. And there's a good chance you've never seen a real number attached to it. So let me give you one. According to a 2026 A Place for Mom report, the national median cost for memory care in the United States is about $6,700 per month. That's about $80,000 a year. And that's the median, meaning half the country is paying more than that. If higher, or I should say in higher cost of living states like California, New York, or Massachusetts, you're looking at monthly rates that can push, well past $9,000 or $10,000. And these costs have been not on hold. They have not been going down. They've been climbing every year alongside labor costs and the increasing demand for specialized dementia care. Now, here's where this gets personal. According to the Alzheimer's Association, their 2026 Facts and Figures report, roughly 7.4 million Americans age 65 and older are living with Alzheimer's dementia right now. That's about 1 in every 9 people over the age of 65. Women carry a particularly higher burden. The lifetime risk for a woman is approximately 1 in 5. For men, for us, it's closer to 1 in 10. And a 2025 study summarized by the Bright Focus Foundation puts the lifetime risk of any dementia after age 60, or I should say age 55, at 42%. That's not a small probability. That's basically, you're looking at a coin flip, all right, slightly weighted against you. These stats, I'm telling you, not to scare you. I'm telling you because most retirement plans I see are built around market returns, withdrawal rates, and Social Security timing. That's all well and good, but almost none of them have any real memory care scenario that's been stress tested. Now stay with me because I'm going to show you exactly what that gap looks like in dollar terms. Let me walk through a scenario so you can see what this looks like in real numbers. Let's picture a couple. Let's call them Robert and Carol. Robert is 72 and Carol is age 68. They've got, let's say, about $850,000 across their retirement accounts. They have Social Security of about $4,200 a month combined, and their plan has always been to live on roughly $65 a month in retirement. They've done a lot of things right. Now, at age 65, Robert gets diagnosed with early stage Alzheimer's. Over the next 2 years, Carol manages his care at home, but by age 77, Robert needs, his need what Carol can safely handle. This is a fairly typical setup. You may have even seen it in your own family. Now, Robert moves into a memory care facility. It's costing $7,000 a month, slightly above the national median because they live in a mid to high cost market. Now, watch what happens to their plan. Their house still needs Carol's $65 a month to live off of. Okay, Robert's care adds another $7,000 a month. So now our total monthly outflow is about $13,500 a month. Social Security covers $4,200 of that, leaving $9,300 a month coming out of savings. That's about $111,600 a year, call it $112,000 a year, out of a portfolio that started at $850,000. According to the data, average stays in a memory care facility in about 2 to 3 years. So we're seeing numbers that are about the same as, let's say, generally speaking, long-term care. About 2.5 to 3 years is the average need there. Though they can extend for much longer, depending on the stage of diagnosis and overall health. In my own family, saw an aunt that needed care in a facility for 8 years, from age 80 to age 88. In our hypothetical scenario here, if Robert is in care for 3 years, that's over $252,000 a facility, or I should say in facility costs alone, or you count for any portfolio growth or decay during that period. If the stay runs 5 years, and that number is not unusual. Again, I've seen this in my own family. I've seen it with plenty of clients, and typically with their parents. Their out-of-pocket cost clears $420,000. Carol, who's already 68 when this all started, still has potential 20 years to fund for herself after Robert passes away, assuming that he passes away first. Now, I've seen this play out, as I've mentioned, more than just once. It's been a consistent theme in my practice and with distant relatives. A family that looked completely fine on paper completely gets devastated by the one event that they didn't model in their financial plan. So, that's the problem. Let me tell you about the solutions, because there are specific ones, and some of them have windows that do close, but typically there are solutions. So one of the biggest misconceptions that I run into, and by that I mean fairly constantly, is that people assume that Medicare will step in and cover memory care costs. It won't, and I want to be very clear about that. Because the assumption is expensive. Medicare cannot be looked at as a memory care or a long-term care safety net. Medicare covers the medical side of dementia. So now we're talking doctor's visits, cognitive assessments, medications through Medicare Part D, short-term skilled nursing after a qualifying hospital stay. All right, and that's up to 100 days, and there are very specific criteria. What Medicare explicitly does not cover is long-term custodial care, which is exactly what memory care facilities provide. The supervision, the secured unit, the specialized staff, the room and board. None of that is Medicare's job. It's not their problem. It's not what Medicare is set up to handle. Medicare's own guidance says it plainly. It does not pay for long-term care. Okay? So kind of end of story with that. Now, Medicaid is a little bit different, but Medicaid does come with some conditions. It's means tested, which means that you have to have very limited income and assets to qualify. In most states, an individual generally must spend down to minimal asset levels before Medicaid kicks in for nursing home or memory care. All right, each state has their own hoops that you have to jump through, but you really have to have your assets spent down and your income has to be below a certain amount. There's also a 5-year look-back period on asset transfers. So you can't simply give your money away, right before you need Medicaid, I should say, and expect that the pro is going to pick up the tab. If transfers happen within that window, it can trigger a penalty period that delays your eligibility. And how that is determined, we really don't have to get into it, but basically they look at the average cost of nursing home care in your area. They look at how much in assets that you gave away, and then they use a divisor to come up with this so-called penalty. It's really just a waiting period, which I guess is the same thing as a penalty. Medicaid planning is real, and it's a legitimate strategy, but it's also a complex one. And it works best when you start planning for it years ahead of time, not in the middle of a crisis. I don't do Medicaid planning. That is just not something that's part of my practice. But if that's something that you're looking to do, then you want to talk with somebody who is well versed in that area. Long-term care insurance specifically now is designed to cover what Medicare won't. That's assisted living, memory care facilities, in-home personal care. A well-structured policy typically pays a daily benefit that can range from $150 a day to $500 a day, and that that's a mean offset of the $6,700 to $7,200 a month that we're talking about nationally. Now, that is an area in my practice that we do a lot of long-term care planning using typically a hybrid insurance approach, meaning there's a life insurance policy that can be implemented, or an old one can be looked at and can be converted to a hybrid type policy, where if long-term care or memory care is needed, then the policy steps in. If no care is needed, meaning the beneficiary passes away suddenly or passes away without needing to dip into the policy, then the death benefit that's associated with that policy potentially is then paid out to another beneficiary. Okay, that's another topic for another day, but that is something that is typically done to plan for memory care. Now, there's a win, and this is the part that most people miss. If someone is already diagnosed with Alzheimer's or another form of dementia, they generally cannot get new long-term care coverage. Underwriting simply is not going to approve them for obvious reasons. The policy has to be in place for the diagnosis, which means the time to talk and think about this is when you're healthy, probably in your 50s or early 60s, when premiums are low and you can still qualify medically. Now, before anyone jumps into the comments saying long-term care insurance is too expensive or the premiums keep rising, yes, I'm very well aware of that. I think most people are. Those are real concerns. And yes, they are worth discussing honestly. Traditional standalone long-term care policies have had pricing challenges, but there are alternatives worth knowing about. Hybrid life insurance policies, as I mentioned, and annuity products that include long-term care riders have become more popular because they offer a use it or lose it solution. Or I should say, the traditional long-term care policies were known as use it or I should say largely were known as use it or lose it policies. Now, hybrid policies address that use it or lose it, let's say, bad taste that was left in consumers' mouths. So if you never need a long-term care, if you don't need long-term care, your beneficiaries, in a hybrid policy I'm talking about, your beneficiaries get the death benefit. There's a trade-off in cost and flex, but for the right person, it solves the premium uncertainty problem. What I would do is evaluate long-term care options as part of let's say, a broader retirement income plan, not as a standalone checkbox. The benefit amount, the inflation rider, the elimination period, and what exactly triggers the benefit all need to be matched to your expected need. And that's where these cost of care surveys come in, because we can plan for needing millions of dollars of care, but then that's going to inflate the price of the premiums that you may be paying. If you use a cost of care survey, and let's say in your mid-50s, early 60s, well, we can project down the road, all right, care is going to cost in a memory care facility $140,000 today. The inflation might be 4% per year. And 20 years down the road, when you potentially might need that care, well, we know that the bucket of money that you might need would be, let's say, $700,000, $800,000, and we can plan for that effectively. Okay. Now, quick question here is, before we go any further, is this the kind of detailed planning breakdown that's actually useful to you? If it is, leave a comment below. It helps me, know what to put our time into. Those comments certainly tell me a lot about where you all are feeling the most unprepared and where you would like some more education. All right, now let's get into the 3 moves you can make right now. All right, we've covered the costs, we've covered the coverage gaps, and now I want to give you a few things you can actually do. There's a couple of items of advice I'd put at the top of the list. First, run a memory care stress test on your current retirement plan. Take your projected retirement income and expenses, then add a $7,000 to $9,000 monthly memory care cost for one spouse, 3 to 5 years, starting at various ages. See what that does to the surviving spouse's portfolio. If the numbers fall apart, then you need a plan. If they hold up, great. You now know that you've actually got a real buffer built in. Quite possible that you do. But I'll bet you most people who do this exercise, most of you that do this for the first time, are going to be surprised by what you see. Second, you want to get an honest look at your long-term care exposure right now, not later. If you're in your mid-50s, early 50s to mid-50s to early 60s, mid-60s, you're still in that window where long-term care options are available to you and they're priced reasonably. That window narrows with the age and health changes. A 65-year-old with pre-existing conditions is in a very different position than a 57-year-old in good health. Don't wait for the window to close before you start looking through it. Now, in my own case, I just having the experiences and having the knowledge, I planned for long-term care for my wife to be provided when I think at that point I was 42 and she was 37. And one of the major draws there was that the price of the policy that I chose for my wife and me, or I should say specifically for my wife, was very reasonable, even with a growing family and so on. Okay, so the younger that you start, the better. Some type of planning is better than none. Doesn't necessarily always have to mean there's an insurance solution, but that's typically the planning that's done. Now, number 3, we got to understand how Medicaid planning might fit into your situation, especially if you're helping aging parents right now who haven't done this plan before. The 5-year look back rule that I mentioned, that clock starts when you make the move, when you're starting to give access, not when you need the care. Families who start that process early have options. Families who start it during a crisis often don't. Working with an elder law attorney beside your financial planner is, in my view, absolutely worth the cost in situations like this. As I mentioned before, in our practice here, we don't do Medicaid plan, but it might be, an alternative to look into. All right, so summing it all up here, what we've covered today, memory care costs are averaging around $6,700 to $7,200 a month nationally. Those numbers have been climbing. We can't say that they'll climb in the future, but just based on past experience, that should be factored in. Medicare does not cover long-term care custodial care, and Medicaid requires very careful advanced planning to use effective. Long-term care insurance options have a closing window as well. You need to act on that any sort of long-term care planning with insurance policy or a diagnosis, and a memory care event of even 3 to 5 years can fundamentally reshape what a survivor spouse has left to live on. All right, this is plannable, but only if you start before the crisis. If you want to sit down and actually run these numbers for your own situation, I'd encourage you to schedule a complimentary, no obligation consultation with me or my team here at Public Retirement Planners. The link is down in the description. We'll look at where you are, what your exposure actually is, and what specific step makes sense for you. Not a generic checklist, but actually a real plan.